If you got sick in ancient times, doctors might have drained all your blood and drilled a hole in your skull just to prevent a simple cough. Today, we're diving into some creepy stories and bizarre facts from the world of ancient medicine. You hit like and subscribe, and I'll throw in a free promo code for questionable historical healthcare. Actually, it wasn't all that bad. Tens of thousands of years ago, our ancestors already knew how to treat broken bones. Sometimes they used clay to set a fracture, and sometimes they just buried the injured arm or leg in the ground for a few weeks. Sometimes it healed, sometimes it started to rot. Just depended on the will of the gods. As early civilizations began to form, two medical professions emerged: the bone setter and the healer. The bone setter worked with his hands and caused pain, while the healer used herbs, charms, and, most effectively, lies. Bone setters weren't popular, but people turned to them when magic spells didn't do the trick. When the first states appeared, medics were put into a separate caste, though not always a privileged one. In ancient Babylon, for example, doctors could have their fingers, or even their hands, cut off for serious mistakes. Maybe some ancestral fear of losing fingers is why modern doctors have such notoriously bad handwriting. Even today, there are people who think bloodletting is a good idea, but in the Middle Ages it was used to treat nearly everything. Back then, it was believed that draining bad blood would cure all diseases. In reality, bloodletting just lowers blood pressure. And that's a symptom, not a disease. In some cases, it wasn't just blood being drained. For example, the poet Friedrich Hölderlin had his forehead burned with fire, causing infected wounds that oozed pus. Doctors believed they were draining all the filth from his body. What was left came out in his poems. Still, that somehow sounds less horrifying than electroshock therapy. George Washington, the first president of the United States, was treated for a throat infection using the finest techniques of medieval medicine, a series of aggressive bloodlettings. He died on December 14, 1799, at the age of 67, when there was nothing left to drain. During the procedure, he lost nearly 2.5 liters of blood. Unsurprisingly, it didn't help. In the Middle Ages, syphilis was almost as widespread as the plague. Today, it's treated with antibiotics, but back then the go-to solution was mercury. Patients were fumigated with it, or given ointments to apply directly to their genitals. But surprise, mercury doesn't actually cure syphilis. People believed that because mercury was so fluid, it could easily pass through the intestines, so those with bowel obstruction were given an entire glass of liquid mercury, usually by mouth, though not always. If the patient didn't die from the treatment, they'd at least lose all their hair. There was also a method called mercurialization, where a patient was placed inside an iron barrel that was constantly heated. Then mercury was added, turning into toxic vapor. This method had some limited effect, but severe poisoning usually set in long before any signs of improvement. Medicine progressed well in ancient Greece, but in the Roman Empire it became an art form. Since Romans were constantly at war and losing limbs left and right, someone had to take care of the soldiers. So they got rid of shamans and healers and replaced them with real surgeons, armed with scalpels, catheters, and rectal speculums. Here are a few Roman doctor-approved remedies. Got a headache? Press a fox's genitals to your forehead. Warts? Burn some dried cow dung and inhale the smoke. Your skin will clear up in no time. And for acne, nothing beats crocodile meat. The best part? You can probably find all these ingredients at your local grocery store. People around the world have always had a strange obsession with cutting things off each other. For example, in 18th century Europe, there was a practice of slicing off half the tongue to treat stuttering. Since ancient times, humans have also consumed one another for ritualistic or medical reasons. Roman doctors, for instance, advised patients to drink the blood of freshly killed gladiators to absorb their strength. Of course, the most terrifying disease in Europe was the plague. With no real cure available, people tried anything. Doctors wore protective outfits with long-beaked masks stuffed with aromatic herbs. It didn't help against the plague itself, but at least it masked the overwhelming stench of death that filled the air. Treatments mostly included prayers, herbal brews, and eating onions, none of which worked reliably. A proper vaccine wouldn't appear until the 20th century, so the best survival strategy was to run as far away from infected cities as possible and stay away as long as you could. In the Middle Ages, doctors didn't have labs to run tests. Instead, like picky wine tasters, they sampled their patients' urine to diagnose diseases. Taste, color, and smell were all taken into account. As bizarre as it sounds, this practice actually helped advance medical knowledge. Patterns began to emerge. They even developed a urine wheel, a color chart that matched shades of pee with possible illnesses. In the late 14th century, something surprisingly effective was discovered for treating infected wounds: ordinary maggots. Doctors would place them on the wound, and the larvae would eat the dead flesh, helping the healing process. So, if you ever see your roommate lying still with maggots squirming in his wounds, just ignore it. One of the most popular medical procedures throughout history was trepanation, practiced since the Stone Age. The idea was simple. Drill a hole in the patient's skull. Let me know in the comments which of today's medical treatments was your personal favorite. That's all for now. Thanks for watching and hitting that like button. See you again soon.